coming up. We'll be on location at Make It Possible LLC in Waldorf, Maryland, discussing advances in anger management treatment and how they can effectively help you control anger and improve your relationships and mental health and wellness with one of this region's top psychologists and certified anger management specialists, Dr. Amarilys Galloza Carrero, as well as Jonathan Galloza, who's also a certified anger management specialist. Welcome, Dr. G. It's a pleasure having you back on with us again, and it's your first time, in fact, on with us, Jonathan. Welcome aboard as well.
Thank you for having us here.
Thank you for having us.
We have a lot to talk about with the two of you. Anger is certainly something that we all have experienced at some point in our lives. However, managing that anger is very important so that it doesn't get out of control and lead to violence or other harmful consequences. So on that note, I'd like to begin, if I may, by asking the two of you, if you can please tell us what some of the most common causes for anger are.
Well, everyone gets angry, and it's a normal thing people do. But there seems to be a sort of stigma against anger. For instance, when someone's feeling sad, people tend to approach and want to see what's wrong with them. But at instances where someone is angry, well, people tend to be taken aback. They don't want to approach them or offer any support to them.
But I guess what it is truly important to emphasize, what is anger? And anger is a secondary emotion. And what that means is that anger is like a mask that is hiding what is happening in the background.
For instance, you have an app and it's not working. Well, that could be annoying. But if it's a banking app, well, then that might be more concerning. Maybe you're afraid that your account might be compromised, and that can cause a certain sense of anxiety. But that anxiety can manifest into anger, and you would show that. And if people see you, people look at you, what are they going to say? They're going to say, that person's angry. When what truly is happening is that that person is anxious, and the anger is a byproduct of that anxiety in that case.
And I guess to answer your question, right, the causes that can lead to anger are innumerable.
Now, what type of individuals are more prone to anger management issues? Based on age, gender, environment, whatever the case may be?
Well, everyone is prone to anger, but we need to make an effort to try to understand what anger is. And frankly, people struggle with anger. And of course, what's more concerning is what people do when they're feeling anger. And anger looks differently depending on the different circumstances that you're going through.
Now, I guess let's be frank about something. Some people might display anger because they are experiencing different circumstances in a sense. So, for example, we have individuals that have post-traumatic stress disorder, and the slightest trigger can provoke anger. And those triggers most likely don't create that response on everyone. On the other hand, it could be that you're an irritable person, which is just fine. You just get upset more often. The problem is when you let your anger run rampant. And then your anger can take you to places that you didn't intend or didn't want it to go in the first place.
And how do you determine that an individual is experiencing anger management issues?
Well, from an outsider's perspective, it's not at all obvious whether that anger event was a one-time thing or it's an actual issue. Like, let's go back to the banking app example. A person who doesn't have anger management issues might just call the bank and be done with the situation. But a person experiencing anger management issues might throw his phone against the wall and then that would be problematic in a sense. It's not about feeling anger, it's about what you do once you feel anger.
So in a way, determining at what point anger is truly a problem depends on the social, occupational, and as well how much that anger is impacting the person's life directly. And our anger management assessment allow us to be able to identify if this is a one-time thing or if this is something that is actually problematic. And it helps us identify as well what type of treatment should be followed. We do use empirical measures for our assessments, and one of the assessments that we use is the Novaco scale and provocation inventory, which allow us to identify anger patterns, interventions, just guide interventions, and if at the end that person truly experienced an anger management problem.
And what would you say, Dr. G and Jonathan, are some of the most effective treatment options that you offer and that you have available in your toolbox, if I may use that term as well again, to help folks dealing with anger management?
Our treatments are based on the SMART approach. That means that it is specific because it targets anger. It's measurable because we use empirical assessments. It's achievable because our plans have a realistic objective. They are relevant because it takes the person's environment into consideration, and time-bound because we encourage them to finish their goal at a timely manner. And this approach is based on research that shows that the most effective methods to treat anger are cognitive behavioral therapy, meditation and relaxation techniques or mindfulness, and anger management sessions, which are psychoeducational in nature. And depending on the person's situation, the sessions could be either in group form or an individual manner.
At Make It Possible, we offer group approaches and individual therapy. And this can be, again, determined by our assessment of what will be the best approach for the client itself. Our objective is to make anger to become something that you manage and not that anger is managing you.
And what type of results can we expect?
We hope to see an alleviation from the exhaustion and constant state of agitation that anger can create in a person. We certainly hope that at the end a person can realize that they can find a breathing room, a moment where your life seems clear, less muddy, and where you can realize that you can have a life that is not full of conflicts.
But to put it more concretely, at minimum, we expect to at least the person to know what anger is all about and at least identify their own anger triggers. And at maximum, we expect awareness of their anger states and for them to be successful in managing them in a healthy manner.
And how many sessions, Jonathan and Dr. G, would you say are typically necessary to effectively resolve these issues? And I know, again, that depends on each patient, each person, but typically speaking.
Well, it depends on the nature and severity of the issue. When it comes to anger management services, there could be different reasons why a client or a possible client might want to reach out. The number of sessions is determined by that reason. We offer a 12-session program, and we use the following book, Anger Management Essentials by Anita Vidian, as a foundation.
Our sessions are provided in English and can be provided in Spanish. And this is the second edition for the anger management for this version of the book. And the Spanish version of this book was translated by myself, and it will be out soon, so we are very excited about that.
Can the results be permanent?
Well, they can be permanent, but what can I say? Things in life sometimes don't go the way we want them to. And although we might wish it to be the case, it's up to us to figure things out. And this is a journey. Dealing with your anger, especially under high stress circumstances, is really challenging.
But having as a goal, experiencing a life of peace and calmness, who doesn't want that? We believe this is achievable. And we also recognize that the individuals that suffer from anger, their life are anything but harmonious. But we believe that with our program, those individuals can experience the peace and calm that they might be seeking.
I wanted to ask you specifically, Dr. G, what is the risk of regression?
Well, when it comes to anger, as we have established before, is a natural thing to occur. It's a natural emotion. It's fine to get upset. And I think that the risk of regression will depend on how well a person has been able to practice, to recognize their triggers, and ultimately be able to apply those things, those tools, those strategies in that moment when your anger is getting out of hand. And because of this specific emotion, right, so volatile, then it's not really a regression. It's just moments that you will have in your life that you will be tested, and you will need to figure it out how to apply those strategies yourself. But in a sense, you should be doing way better at the end because you have strategies compared to when before you didn't have them and you got upset and you did all these things again and again and again. So your life will most definitely have improved.
Well, on that note, I'd like to thank you both, Dr. G, Jonathan, for joining us and educating us and being guests on our program. It was certainly a pleasure having you all on with us today.
Thank you so much for having us.
Yeah, we are very glad to be here.